think we're there. Excellent. Okay, so welcome everybody to our Team Phenomenal Hope Town Hall. I'm Patty George. I'm a PH pulmonologist, Team PH athlete, and co-founder of Team Phenomenal Hope. And I want to thank you all for joining us for our second educational town hall as part of the Tour of Phenomenal Hope. I'm so excited to introduce our guest speakers today. But before I do so, I want to tell you a little bit about Team Phenomenal Hope and one of our featured programs. So Team PH was created to bring together a worldwide team of individuals to build a community and improve the quality of life for those living with pulmonary hypertension. To succeed in our mission, we embody the culture and the spirit of endurance racing, unifying patients, caregivers, athletes, donors, and supporters to raise awareness about pulmonary hypertension, as well as funds to support research and unmet patient needs. This week's program is sponsored by our Let Me Be Your Lungs program and our Patient Unmet Needs program. In the Let Me Be Your Lungs program, we pair athletes with people who live with PH, giving athletes a very personal reason to run, bike, swim, hike, whatever, with Team Phenomenal Hope, and helping share real life stories and experiences about pulmonary hypertension. When people see our jerseys and ask, well, what is Team Phenomenal Hope? We can then turn that question into who is Team Phenomenal Hope? And work to really share real experiences with people who may have never heard about pulmonary hypertension. Since this week focuses on people living with pulmonary hypertension, Team PH also has a patient assistance fund where we fund micro grants at the beginning of every month to help patients with non-medical unmet needs. There already are patient assistance programs that exist for drug costs and copays, but this is for people who have things that aren't covered through insurance, like perhaps transportation to get to a center for a CTEP evaluation, or funds that could help during the times when people are between jobs or need COBRA coverage, that kind of thing. So you can learn a lot more about these programs at our website, teamphenomenalhope.org. So today's program is a topic that is very important to all members of the PH community, from pulmonary hypertension clinical teams to PH patients and caregivers as well. And so I'm honored to introduce two very talented presenters today to lead us in this discussion. So Cindy Schmidt lives in Casper, Wyoming, and she's the mother of three beautiful children, ages 23, 24, and 25, and she's about to be a first-time grandma in April. She's taught kindergarten for 23 years, and this year, due to COVID, she made the decision to teach kindergarten virtually. I'd love to ask you questions about how that's going with kindergartners. She likes to stay busy and active. She runs, she bikes, she hikes, and she is learning to sew and crochet so that she can, quote, officially be a grandma. She's had lupus for 30 years and pulmonary hypertension for about 5 years, and she refuses to be slowed down and continues to celebrate life each day. Dr. John Ryan is the director of the University of Utah Pulmonary Hypertension Program, and he is a world-renowned cardiologist in pulmonary vascular disease. He's an Irishman. He's husband to Jenna, father to three girls, ages 7, 5, 4, almost 5, and 1 year old. He's known for running and telling stories and likes to do both of them at the same time. And so with that, I'm going to turn this over to John and Cindy, who are going to talk to us today about empowering people living with pulmonary hypertension. Thank you, John and Cindy.
Thank you.
Thank you, Dr. George. Thank you so much for having us. And it's a real privilege to be here, and you're doing really great things for the community and for patients or people with pulmonary hypertension. And the important thing that I think is worth remembering is that anytime when we were talking about this, we said, let's talk about empowering patients living with pulmonary hypertension. And Cindy and I felt, no, we need to talk about empowering people living with pulmonary hypertension, because the patient unfortunately introduces a hierarchical structure. It tends to separate the illness from their lives. And it's important to recognize and acknowledge that these are not just patients. These are people. These are people like Cindy who are about to be grandmothers, which is still ridiculous. And there are people who are, in the prime of their lives, or people who are older in life. And everything that we do as physicians and as care teams taking care of them has an impact on their lives. So it's important to recognize, bring the person back to the patient. So that's why Dr. George and ultimately changed the title to Empowering People Living with Pulmonary Hypertension. Empowerment is just key to so much of what we do. And so many, when you have a disease state, it can be demoralizing, it can be frustrating, it can make you feel like you're not in control. And so one of the things that's important to keep in mind is figure out, how do you gain back control? We as physicians and care teams obviously try and contribute to that, to give you the control back over your life so that you can actually have an impact in your life. But when you feel disempowered, that can result in disillusionment and bitterness and sadness and social isolation and physical isolation, which obviously a lot of us are going through right now. So it's important to try and figure out how to address your narrative, meet your challenges head on, and ultimately change your narrative and have these challenges shift from being challenged to being negative to something that's positive, so that this becomes that you are in control of your health and that you are in control of your life. And we as physicians and care teams, our medical assistants and our pharmacists, we can certainly help with that. And but increasingly that burden and that responsibility does fall on the people who have pulmonary hypertension. So hopefully over the next 30 minutes or so, we can talk about different ways in order to do that. Cindy, I'm going to take a step back and then kind of bring in some other concepts after you kind of introduce your main ideas.
Thank you, Dr. Ryan. And I totally agree with him. I think when I first was asked to give this talk, I wanted to figure out what I wanted to say. And I definitely wanted to hit on the part of you have to be an advocate for yourself, which is kind of interesting after I heard what Dr. Ryan wanted to talk about. So you definitely have to be an advocate for yourself, and you're responsible for your health and your actions and how you face the challenges of your illness or disease, or whatever you want to call it. So you definitely have to be positive, keep that positive attitude, and just keep on living.
Now, how have you done that, Cindy?
Well, I definitely keep active.
Yeah.
Like they said in my introduction, I definitely like to run. I run every day, whether it's outside or inside, especially in the winter, it's inside. I like to hike when it's nice. I like to bike as much as I can. Anything to stay active, especially right now when we are stuck inside with COVID and everything. I try to keep in contact with friends and family via Zoom, having coffee with them via Zoom, all those different ways you can stay connected to people so you're not alone. You have, your support groups and your support team.
Yeah. And I think with the support groups, I think are key, and kind of an idea that we've advocated for in this area is collective care. That when you do connect with people, the challenges that Cindy has, there are a couple of other of our patients on right now. So thank you. If you see me and you're on this video call, thank you for being here. If you don't see me and you're on this video call, also thank you for being here. But we do have this concept of collective care, and we coined this phrase, and the idea being is that you try and network with people who have a similar disease to you and kind of figure out what works for them, such as what Cindy's describing in terms of exercising every day. Unfortunately, not everyone has the self-motivation or has the resources to be able to exercise every day. So it's a matter of, in this area of collective care, figuring out what does work for you. And again, it does become very individualized. And there's not necessarily a competition, and that one person who lives with pulmonary hypertension is dealing with it better than another. Namely, that people with pulmonary hypertension have very different diseases, and we've all seen this. Dr. George and I have seen this, that there are some people with pulmonary hypertension and it's You see them once a year and you talk about grandchildren and you show photos and so on, and it's very straightforward. It's a social visit. And then there are other people with pulmonary hypertension who you see once a month, and you see them in the hospital, you see them outside the hospital, they're back in the hospital. And there's not necessarily to say that one person is handling their pulmonary hypertension better than the other, but rather it's a matter of figuring out what are the parts of your disease that you can be in more control of, and what will your care team help you become empowered in. One of those, actually, I think that to a certain extent, our pandemic has actually assisted in patient empowerment, or empowering people with chronic disease. Because historically, when Cindy would come in to see me, or any of you on the call would come in to see me, we would weigh you, we would measure your blood pressure, we would check your heart rate, and I would come into the room and I would tell you how you're doing. And that's really changed now, because now with the remote visits that are going on, or the decrease in terms of people coming in to see you, you are weighing yourself, or hopefully you should be weighing yourself. You are measuring your own blood pressure, you are measuring your heart rate, you're measuring your oxygen saturation, and then you're telling me about that, and you're telling our team about that. And that has been a really beautiful thing to see. And it's actually, Dr. George has challenged me a little bit, that all the things that we used to rely on, the echoes, the 6-minute walk tests, all the things that those of you who are patients have often not necessarily dreaded, but found inconvenient, and our medical assistants have found it burdensome to schedule. All of those things, as I said, echo, 6-minute walk test, BNPs, we used to rely so heavily on them. And now Dr. George and I now are taking a step back, and we're saying, my goodness, we can't have an echo every 3 months, or at least should we have an echo every 3 months? Should we have the 6-minute walk distance every 3 months? Should we be doing DLCOs once a year? Should we be doing CPETs, which require, COVID-19 testing, and there's aerosolation and all these things? Or should we actually not just be in a dismissive way, but focusing more on, what does the patient tell us? What does the person with pulmonary hypertension tell us about their weight, about their blood pressure, about their heart rate, about their oxygen saturation, and about how they're feeling? So gone are the days, I think, and I'm thankful that they're gone are the days where you would see your physician and say, well, and you'd come home and your family members would say to you, and I always remember my mother saying this to my father when he'd come home from the physician, and said, well, what did the doctor tell you? How did the doctor say you are doing? That's gone now. The doctor isn't telling you how you're doing. You are telling the doctor how you're doing. And then obviously us and our team kind of weigh in around the fringes when there's more uncertainty. Cindy, I'll pass that back to you to either comment on that, or Dr. George, if you want to make a comment on that as well.
I agree completely that that's definitely gone away. I've always kind of tried to do that on my own. And as Dr. Ryan can attest, that I've always kept track of my blood pressure and my pulse and my oxygen levels. I have a nice little watch, which I'm sure a lot of you have, that does that for me, which is nice, but I do it at home as well. So you definitely have to be aware of your body and what it's telling you. And you have to have that communication with your doctors and being able to talk to them freely, which again, he can attest to. I talk to him lots about, oh, gee, what does this mean? You're fine. So yes, you have to definitely ask those questions. If you're not sure, ask them. They'll let you know.
Yes, I've got a lot of, Cindy has sent me a lot of questions about BNP over the brain natriuretic peptide, BNP over the years. And then, Dr. George, you'll appreciate this. There was one moment, I think, where we moved from BNP to pro-BNP, and Cindy's number increased. Yeah. So yeah, Dr. George, would you mind kind of commenting on what we've talked about so far?
Yeah, so these are you're making such great points. And, I find it amazing, we talk a lot about all the negative things that have come with the pandemic. And certainly there are a lot of negative things that have come with the pandemic, being, a critical care physician and taking care of really sick patients. Yeah. But on the positive, and I heard Dr. Ray Benza talk about this in an earlier, in our town hall in the summer, it has forced us to modernize and shift our perspective in how we take care of patients. It forced us, our institution, to adopt telehealth and telemedicine and become a bit more patient-centric, and to help serve people in the comfort and safety of the pandemic. And yeah, I think that it is interesting because occasionally I'll have, like, we'll start a visit and the patients, there are certain people that may be looking to me to tell them how they're doing, but I'm always, like you say, entering the room, trying to learn from them. The thing is that the tests only tell us so much, and we gather so much from actually talking with someone and hearing how they're doing in their life. You're running through how they're doing as they're telling you their stories, and how much they can exercise, and are they hitting their goals. And I think that that's as important, if not more important, like you say, than our routine testing that we perform. I don't know that everything will go by the wayside, but maybe that routine standard timing of things certainly will. And certainly in the time of this pandemic, it has. One of the things we do in our clinic that I try to shift, especially when I'm seeing new patients, is have a discussion about what are their goals.
Yeah.
When doctors approach things, we're like, okay, what do we want to do? We want to lower their pulmonary pressures. We want to make their echo look better. We want to make them walk farther. Like, we have all these little micro things that we would like to see happen. But the reality is, what does the patient want? They want to maybe play with their grandkids and be able to, like, take them to soccer practice, or continue to hike, or do whatever, so it's important, I think, to get that sense so that everybody can unify around what is that goal. And it's not just to lower the BMP, for example.
Yeah. And I think the goals are incredibly helpful because they end up putting things in context. And I would even push you, Dr. George, that it's not only absolutely playing with grandkids, but say, for example, there's a trip coming up, or they want to go on a cruise. Not many of our patients are going on cruises anymore, for obvious reasons. But is there a wedding, or is there a birth, or is there something along those lines that they really feel that they want to be a part of? My own my own mother-in-law had a lung transplant. I think it was actually 4 years ago this week, and her goal was to be able to hold her grandchildren. She had a whole bunch of, well, not a whole bunch. I had contributed a lot to her grandchildren, but she hadn't actually held any of them. And then actually Stevie, our youngest, who's almost 2, she was the first one that she got to hold. And that really was, to me, that was really kind of powerful. I never, she'd had grandchildren, but she never got to hold one. And that really was kind of powerful in terms of getting an idea as to what her goals are. I think it's important to push. I do think that our care teams are in a position right now where, or at least it's important for you to find a team that you feel comfortable with, that you can push, and that you can be direct with in terms of explaining what your goals are, and how you want to take charge, and how much you want to take charge. There is a tendency, and there has been some hesitancy, and many of our team are on the phone call here. There is a tendency to get a sense as to, there's a hesitancy at times to feel that we are putting a burden on you if we tell you that you need to do this, that, and the other. And because you come to us for trust. And so I do think that as patients and as people with pulmonary hypertension, it's important for you to push your care team and say, I want to take charge in this. I want this to be my priority. I want you to let me take care of this. And I think that's important. I am concerned that with the shift towards virtual visits, that there are populations that we are missing. And those populations are people who have lower socioeconomic status. They cannot afford smartphones or cannot afford reliable internet access, and are not able to, or may have health literacy problems. So things like, weight and blood pressure, and, and up titrating and down titrating diuretics. I have a concern that we're missing them, or have a chance of losing them. So if you feel vulnerable, and if you feel that you're in a position where you might get lost, I think having an advocate for you, either a son, a daughter, a child, a spouse, a neighbor, having someone that you feel comfortable can be your advocate. We have talked to a whole variety of children. We've talked to a whole variety of mothers, and if I can't explain what I'm doing to your mom very well, then I'm not doing a good job. I need to be able to explain to mom what I'm doing. And it needs to make sense to mom. Because when you have the disease and when you have the illness, you're so wrapped up in everything that's going on and all these words and all these new terms that are just incredibly hard to grasp hold of, that it needs to be, and there's such an emotional component to it, that sometimes, and we will say this, and Dom's on the phone or on with us now, that we will turn to the patient and we will say, do you want me to call mom? And they will say absolutely. So find someone in your life who is willing to be that advocate for you, and have your physicians contact that person. And I think that helps empower you. It gets you to sit down and reflect and think about what your goals are. And it also, Cindy said something that was quite important. She said, it's important to stay connected, and it's important to talk about what you're going through. Not everything that you will go through and will be a success in terms of your pulmonary hypertension care. Not everything that I will do, if you are my patient, as Cindy knows, not everything that our team does is successful. We have compromised kidney function along the way, or we've missed things and people have ended up in the hospital. And it's important to share those things. We talk about it as a team. We share it with the patient. We oftentimes admit the fact that when we recognize mistakes that we make, we admit it. But it's important for you to have someone that you can stay connected with, to share your challenges with, to share arguably your failures with, and then to kind of plan proactively as to, I'm going to make sure this is never going to happen again. And certainly, as our team knows, there are many conversations we've had where we've said, this is never going to happen again. And we also think that that's important for patients to have that. I am not going to let this happen to me again. Cindy?
Absolutely. I mean, there's been many times, as you mentioned, the BNP, I'm always calling him, what can I do to lower that BNP or that pro BNP? What can I do? What am I doing wrong that this is not working? And it's, as I've found, it's kind of trial and error. Well, maybe if I do this, it'll lower, and then the next test, okay, that worked. And it's just, trying to see what works for you and your body and your team. And, I'm probably one of the worst people of, talking about my issues with my friends and stuff. I like to, as Dr. Ryan knows, I'm very independent and very stubborn. So I like to try to do everything myself. But there comes times when you just need that friend, to be able to reach out to and say, hey, this is a rough spot, help me out, or, help me advocate, or how do I want to approach this? So you definitely have to have that support team. So.
Yeah. And have that access to your team. I mean, God Absolutely. Knows, listen, we are not the best role models in terms of giving people access or people having access. It's so hard, right? You look at this and you think you should be able to contact me, or as I said, Dom, who's on the call, fairly easily. But there's so many moving parts that oftentimes we have a challenge with that. And again, that's something that we work on as well. But again, if that's something that you experience, you then say, listen, the number of times where people have said to us, I tried to call you, Dr. Ryan, and they told, oh, yeah, this is nice, Dr. George. I'm sure this happens to you all the time. I tried to call you, Dr. Ryan, and they told me you were out of town for the month of October. Where did I go?
Days.
I know. They told me you're on vacation, and I'm like, my goodness, I haven't had a month-long vacation in I don't know how long, since I was in high school probably. So there are times. So it is important and us to work on that. But again, give feedback to your team that listen, this happened and it actually wasn't good enough. There's a comment in the chat that I want to address because it touches on something that, and I can talk about my mother-in-law here because I think it's relevant. It reads, I'm a patient of Dr. George with group 3, sounds like functional class 3 pulmonary hypertension. So pulmonary hypertension secondary to hypoxic lung disease. And it is Doug Evans. So Doug then moved to Florida, and his quality of life increased by 1,000%. No longer on oxygen, participating in the Let Me Be Your Lungs. Congratulations, Douglas. Thank you for doing that. Is this an atypical response for just me, or could moving to sea level benefit all group 3 patients who are living at a higher altitude? Patty, go ahead and make a comment there, seeing as you know Doug, and then I'll weigh in.
So, I think it's challenging. So when we, here we are in Colorado, Utah, and everybody that we see that lives here lives at altitude. And certainly with that, what we usually say is if you're willing to use oxygen and keep your oxygen saturations in the, 90s, mid 90s, then we're overcoming, at least we hope we're overcoming the hypoxemia of living at elevation where our air is a bit thinner. But we often hear, not only from Doug, but from other people who've gone down to sea level, maybe on vacation, they've gone to San Diego, wherever, that they feel like $1 million and they didn't have to use their oxygen and they could do all this stuff because of course it's just a bit easier to get the oxygen into your bloodstream when you're down at lower elevation. And so I think it depends on the patient. I've had other patients who've gone to sea level and it wasn't the cure-all. It wasn't the 1,000% improvement, unfortunately. But I think it varies patient by patient, person by person, how they respond to lower elevation.
And I think a lot of it comes down to quality of life. And we had this with my mother-in-law. She lives here in Utah, and she had chronic lung disease, similar to you, Doug. And at the time, actually, we lived in Chicago, which is at sea level. And we talked about, let's move to Chicago. However, in Chicago, she wasn't going to have her friends. She wasn't going to have her family. She's a large network of family here in Salt Lake City. So she felt that despite the fact that she might breathe easier, to your point, Doug, her quality of life wasn't going to be better. Because quality of life, breathing is a large part of it, but other parts of it is actually your social supports and the people around you, and going to, at least historically, going to family get-togethers and so on. And so ultimately she decided to stay here, and then ultimately we moved here. But I do think that it comes down to quality of life. Listen, I have no doubt that if I lived on the Florida Keys, my quality of life would be pretty good. But again, I don't have a job for me in the Florida Keys. So there are these kind of balances that you need to have. One thing, let me look at Kathleen Richardson's comment here. For the first few years after diagnosis, I interacted fairly often with my nurse. Our PH clinic assigned each patient to a nurse. We interacted mostly via email. It was very helpful, and I felt like access to information was very good. Absolutely. Thank you, Kathleen, for that comment. I think that is something that we're all trying to do more and more of, and just being able to, I think, to a certain extent, the answers, there are answers out there. It's a matter of finding the right resource for it. It should be your care team. It absolutely should be your care team. And it can be, as I said, your collective care. It can be the network that you're surrounding yourself with. There are resources online, just like it's important to, and there are, Facebook groups, etc., for pulmonary hypertension. But just the same way that it's important to be cautious and do your background in terms of the news that you see on Facebook, it's also important to be cautious in terms of the medical advice that people might give you on Facebook. And even if we just go to Doug's comment about with group 3 pulmonary hypertension, the number of people that we have had, various people even within the same circles of friends, and one has group 1 pulmonary hypertension and is on Remodulin, and somebody else has group 4 pulmonary hypertension and they underwent a pulmonary endarterectomy, and the person who had the pulmonary endarterectomy is asking, well, they did a surgery on me to get rid of all the high pressures in my lungs. Why can't they do surgery on you? So I think it's important to bear in mind when you're in these social networks, either online, that the context matters and the disease matters, and you do have a very individual, each of you has a very individualized disease that does require individualized treatment, and making comparisons can be frustrating and can be challenging. But I will say it's important to take those comparisons, take that feedback, and then bring it to your care team. Say, I love it when people come in with printouts from the internet, or they say, I read this article online. I absolutely love it because if it challenges me, and it also, I learn from it, and I may not have come across it. Because Dr. George and I are so stuck in our world of, scientific literature and academic publications that there's a whole lot of stuff that we don't see. So actually bringing stuff is useful. Go ahead.
I ask you a question for both of you. You touched on it a bit, where you talk about navigating the social media and, WebMD, not the website, but when people go up and look up information on the internet, which is very rich. Do either of you, Cindy, John, have advice? So how should somebody navigate the internet so that they're not frightened by reading horror stories? Or how do they know if I were a person living with PH, what would you guys tell me in terms of how should I go about deciding if something is legitimate information or not legitimate information?
Cindy?
I think I'm really bad about this because anytime something is wrong with me or my kids, I'm on the internet. It's my first step. I am on the internet trying to research, what is this? What can we do? Is it preventative? Are there tests? Are there cures? What can we do? I'm really bad about that, as Dr. John Ryan knows. But I think the most important thing to do is if I do find something and I'm really not sure if the website's accurate or the social media, whatever, is ask your provider, ask your team. If you have a really good team like I do, they're willing to answer those questions for you. I mean, because what's out there is you just never know what, like you said, the horror stories, are they accurate? What isn't? So you need to be asking those questions for sure.
Yeah. And I think, thanks, Cindy. And then I think, and again, some of our other patients are on the call here, and one of them in particular wears the most fabulous Pulmonary Hypertension Association t-shirts every time I see them. And so I do think, so that person is well connected with the Pulmonary Hypertension Association. And I think it is important to, the resources that are put on by American Heart Association, pretty good. Pulmonary Hypertension Association, pretty good. They are vetted, and there is a standard that you need to reach to have something posted or there. So I think those are resources that I think are worthwhile. Blog posts, probably there's less standardization there. There's less of a standard in terms of accuracy of information or reliability of information. So I think blog posts are challenging. But again, this is all about, engaging in discussion. And if you see something that piques your interest, raises your frustration, again, this comes back to the empowering thing, and you are in control of you want to be in control of your disease state, then talking to your team who are taking care of you, just the same way that you do in other aspects of your life, and then making your own decision about it is incredibly important. We will support people no matter what, based on their decisions. We are, all of us are trying to be truly patient-centered and centered in terms of that the decision makings are in your interest. Now, obviously, if we see that you might be traveling to get shark stem cell transplant, in Tijuana, we're probably going to push back on that. In fact, we have pushed back on that, and we have raised concerns that I don't think that shark stem cell transplant is going to work for you. And if we do it in a respectful manner, at least I think we do, and then we have that discussion, and we have had patients who've still gone on to get it done, and guess what? They came back and they were still our patients. And so I do think that it is important to get yourselves in that situation where you do feel in control of your disease. Another way that I think you can get, so those resources, Pulmonary Hypertension Association, American Heart Association, some sort of vetted resources, and then talking to your team. Another way that I actually think, and Cindy, I want you to touch on this. Cindy and I didn't prepare anything. It's going very well, at least I think, yeah. But Cindy, I want you to touch on this. One of the things that I think is actually quite empowering is clinical trials. I think clinical trials are very empowering for patients and for people who have pulmonary hypertension, because you're now introduced into a new area. You're doing something novel. You get extra, to a certain extent, you do get extra attention, maybe extra testing, more, more right heart caths, more echoes, something along those lines, that you get a better idea as to how your disease is progressing. You're getting more frequent clinic visits, more touch points, as people call it. And it does take a certain onus on you to be familiar with what the trial drug is doing or device is doing. So it does require you to have a level of awareness of your disease state, that it does actually contribute to your understanding of your disease and ultimately advocate for you further. So I think clinical trials are great. Cindy, you've been in clinical trials with us. What kind of drove you to be a part of these clinical trials? What has your experience has been? You don't need to say nice things about me unless you mean it. And can you touch on that?
Well, I was in a clinical trial last year, and I decided to be in it because I really, not only would it help me, but I think I was more interested in, would it help somebody else? How, if this drug, if I can show that it does help and it works, think of all, the millions of people that it could help people be able to breathe. I mean, I'm stubborn, but there's times I still can't breathe, and it's frustrating, and I understand that. And I was like, if I can take that away from somebody, I'm all for it. So I was, definitely wanted it to help me be able to breathe and do things better and be more active and be able to reach those marathon goals I have. But it was nice that, to think that maybe it could help somebody else as well along the way. Yeah, it was frustrating at times. I was down in Salt Lake a lot, but it was nice too. It was a nice break from work. Nice break from those 5-year-olds every once in a while. But the team was great. We got down there, we did what we needed to do, and we were done. I thought we had some great results, so it was definitely worth it. And I would definitely do it again. So.
Good, and we have you lined up for some clinical trials as well.
I always say, try it. I definitely, when I looked into this trial, when I was first asked to be in it, the first thing I did, of course, is you go to that internet. And of course, there's nothing on that drug because it's a clinical trial.
Sure, yeah.
So there's no information, but you have to weigh the risk too of what the side effects and that kind of stuff is, because I still needed to be able to work. I needed to hopefully be with grandkids eventually, which I am now. So that's good.
Perfect. Go ahead, Dr. George. Any other comments?
I was just answering a question that came through. One of our participants said, "Why was the chat box disabled for attendees?" They said that this is not empowering to have it this way. So I've been sending messages. So I apologize. I was half listening because I was trying to solve this if I could. We're using this new Zoom format. So with that, we're directing people to the Q&A, but I understand that it's more interactive if people can actually chat amongst themselves in that space. I don't know if we can change it after the thing is started, but I sent out a question to our tech help. So I'm trying to address that. And if we can, we'll enable it. So very good point. We're trying.
Yeah, thank you. Thank you.
For Zoom thing. I should say you're muted. That's also a Zoom.
I know, exactly.
Okay, the chat box is open now. So
oh, great. There are one of the things that I think people could look into then are patient-reported outcomes. And this goes back to something we kind of touched on at the beginning, but patient-reported outcomes are increasingly being incorporated into clinical practice. And these provide ideas about quality of life, symptom burdens, and burdens of functional disabilities. And there are ones available for heart failure, which is many causes of pulmonary hypertension are from heart failure. There are generic ones. One in particular is the Patient Reported Outcomes Information System, or PROMIS, and these are freely available. And then there's visual analog scales. So there are some scales available that you can use, again, to kind of reflect onto where are you standing and where do you want to be. And again, with this being your outcomes measured and reported by you. And with that, then, I think it's also important, self-compassion is good. So when, in terms of empowering people with pulmonary hypertension, taking care of yourself is good. There is no one's going to criticize you, or at least nobody should criticize you for binge watching Queen's Gambit or something along those lines. It is, you should celebrate the successes, but in order, self-compassion, passion, obviously, coming from the word love, loving yourself and celebrating your successes and your challenges, not to the point where you're harming your body, such as, eating 3 tubs of ice cream, or, going to Olive Garden 3 nights in a row. But actually practicing self-compassion is a very empowering thing and an important thing, and then re-energizes you and redirects you towards the next challenge that you face yourself, either with starting a new medicine or starting a new exercise program or something along those lines. So just the same way that Cindy had mentioned the importance of sharing and connecting with other people, it's also important to share and connect with yourself, and finding the best way of doing that.
Really good point. I think we can all take lessons from that, to be honest with you. Let's see, I'm looking.
No, I think we're good. I think you just, as much as you can, stay positive. And, there's days I do feel yucky, and sometimes it's due to those new meds you get put on. But you know what, I kind of look at it this way: I'm going to feel yucky if I go to work, and I'm going to feel yucky if I stay home. So I might as well go work and be productive, and maybe empower somebody else or another child or whatever it is. So just try to stay positive and just keep on going.
Fantastic. I have a question for you, Cindy, and John as well. What if people are at a place in their journey with their chronic disease, and in this case, pulmonary hypertension, but this can apply to so many conditions that people live with, where it's like they are struggling to get to that point where they can see the hope. Like, you're overwhelmed, and it's like they can't even quite yet know how to build that structure to help them get to that next level, like to get above water.
Yeah. Cindy?
Well, I think we've all been there, whether it's with an illness or whatever else, where we've had it with the day or whatever it is. We're frustrated. Life happens, as we all know. Always have to take a step back, and I think maybe look around you, whether it's that sunrise, that flower, that garden, whatever it is, and say, you know what, there is still good out there. Maybe you see somebody else doing an act of kindness, there's still that hope out there. And, you have to keep pushing on. I think that I see it in my kids, and my kids are just as, they're a good, strong support system. They always are pushing me and, hey, come do this with us, come run this with us. So my daughter just wanted me to run in a turkey trot, and I'm like, I'm not so sure with COVID, but maybe we'll run around the house or something. I don't know. But, you just always have to try to find positive in everything you do. And eventually it builds up, I think.
Mm-hmm.
Look to your friends, look to your family.
Yeah. And I think, there's, it's hard. I think, the 3 keys to a happy life, right? You need someone to love, something to do, and something to hope for. And I think hope can be hard. It's you can look in. Some people find hope. It's we'll just keep quoting here, but Bob Dylan says you find God in the church of your choice. So you can find God in the church of your choice, and that can give you hope. Or you can find it through music. Specifically, Dylan was referring to the music of Woody Guthrie. or you can find it, actually what Cindy touched on was quite nice. You find it in nature, and arguably you find both of those things in nature. So I think that it's important to find, what is your hope? Where do you find hope? It's not prescriptive. And I do always have some concerns, you know, when Patty even, you know, invited us to talk today. We are obviously, Cindy is my hero. Cindy is an amazing person. She's a friend. She's a friend of our family at this stage. She's been over at her house, but she is incredibly successful. And arguably, sometimes these formats, Patty, and this isn't a criticism, it's just in general, oftentimes, unfortunately, we bring, our emphasis is on the people who are doing well, right? The challenge with these things is that it's hard to bring people on who are not doing well and figuring out what their challenges are because they're not doing well. And so, and that's the same thing that I'm concerned about, again, with our, going back to our pandemic, that absolutely for a lot of people it's very empowering. For a lot of other people it's been isolating, and they can't afford a blood pressure cuff, or they don't have the, and so on. So so I think all of us are trying to figure out the best way of doing this, and really it does come down to hope, and it comes down to a support system, and it's a matter of finding those two things.
I have a few more questions in the question and answer, and I know we've gone a bit over time, so are you okay for a few more minutes?
Yeah.
Okay. Dr. George and team, great presentation. If I say it is focused on, let's say, for discussion, the USA, what are resources in the less developed world, so this specific group that one can reach?
Yeah.
And this is from Dr. Sharma in Philadelphia.
I think the Pulmonary Vascular Research Institute, who Dr. George has done work with them, PVRI, I think they have made a concerted effort in terms of connecting people in less developed worlds. Pulmonary Vascular Research Institute, PVRI, I think it's pvri.org, and maybe you can even type that, we can type that in the chat. Dr. George, right, I think you've traveled with them. Yeah,
absolutely. It's a great group. And I think they're trying to increase resources, at least from the last meeting.
Yeah, great. New meds from Jonathan Broom. Yeah, obviously I think a lot of us are, there is the Acceleron data, specifically there's medicine called sotatercept, and that's been analyzed in terms of pulmonary arterial hypertension. Phase 2 studies have been completed, phase 3 studies are starting. And so that's one area. It's a subcutaneous injection every 3 weeks. So it's one area in particular that people are very enthusiastic about.
And I would definitely echo you and say, tune in next week, people, because we'll have a talk completely on the latest in research. And I'll tell you about that in 2 seconds.
Great. Thank you, Dr. Kathleen Richardson, for your suggestions. Kira, who suggested knowing others who are going through it can be helpful, and I agree with that. What would you say to those patients that are recently diagnosed and see their diagnosis as a death sentence? I know that my experience when I was first diagnosed at 31, I'm about to be 37, congratulations, Kira, and I honestly at the time didn't think I would make it this long. That's so true. I mean, and Dr. George and I have seen this time and time again. Someone comes in and they said, I have pulmonary hypertension, and I looked up online and I'm going to be dead in 3 years.
Yes.
And that's the pervasive thing that you look up online. And that date, so what we do say, Kira, is we tell people that data is from the early 80s when there are no medicines available. That data is strictly speaking specific for pulmonary arterial hypertension, or what was then known as primary pulmonary hypertension. So it does not refer to Doug's disease of group 3 pulmonary hypertension, or other people who have heart failure associated pulmonary hypertension. And it may not even be relevant is not relevant in the modern age of pulmonary arterial hypertension because we have treatments available. So that's what we tell people, Kira, when they find out. Great. Then Jeannie, Tom is looking for Dr. George's email address. That's great. Yeah. Good. Oh, thank you for the PVRI link, Patty.
Yeah, absolutely. Okay. So you guys, thank you so much. And I always learn so much when I get together with you, John, and Cindy. Thank you so much. And now we're doing it virtually, but thank you for your time and your expertise and your experience. It's just been fantastic. We also want to thank our sponsors of the Tour of Phenomenal Hope. Our sponsors are Janssen, Acceleron, and Bayer, and United Therapeutics, CVS Specialty, and Altavant as well. A couple more notes. Today's broadcast was recorded and will be shared online in the future, so please feel free to share with your friends and other people in the community. Our third and final town hall is going to be next week on Wednesday, November 18th at 11 a.m. Eastern, 10 Central, 9 Mountain, 8 Pacific. And we'll be welcoming Dr. Jean-Luc Vachieri, PH cardiologist, who's going to talk about research breakthroughs and where we are headed. So I think many in this group would find that hopefully an interesting topic. Please mark your calendars and join us for what will be another interesting talk. And finally, we have a special event this weekend, our Tour of Phenomenal Hope Championships. So while this is all going on and we have our educational stages during our Tour of Phenomenal Hope, we have 12 athletes from the PH community, doctors, nurses, members of our industry partners, and Team PH athletes who are all gonna come together from all over the country for a live Peloton challenge. It'll be Saturday, November 14th, and they'll be racing to make a difference as we raise awareness live via Zoom. So you can join us at 3 p.m. Eastern, 2 p.m. Central, 1 p.m. Mountain, high noon Pacific, so whatever time zone you're in, to cheer them on in this race. So I hope that you'll join us. It's gonna be a lot of fun. If you wanna learn more about Team Phenomenal Hope or wanna check out our course map of all the events this month, please go to our website at teamphenomenalhope.org. And finally, if you like what you heard today and you wanna help support our work, please share our link to donate, which is teamph.org/donate. And with that, I am going to thank again Cindy and John Ryan and everybody who made today possible, and we'll close out with a video preview of our championships coming this Saturday to get you pumped. It's just a minute-long video.
Stage 1, this is what warm-up looks like. This is what warm-up looks like. And stage 2, November 7th. Stage 3, what we're doing for the patients, November 14th.
I'm honored to participate in Team Phenomenal Hope. Anything that brings the PH community together and shows support is worthwhile.
I'm participating in this month's Tour of Hope with Team Phenomenal Hope to help raise awareness about pulmonary hypertension.
First and foremost, it's an honor and a privilege to get to do this. To ride for someone else's lungs,
I'm super excited for Pulmonary Hypertension Awareness Month, and I'm really excited to ride with Team Phenomenal Hope here on my Peloton.
But I am racing with Team PH to lend my lungs to all of those PH patients that are fighting every day for a breath. Please join me and my partner Alex in raising awareness. Wish me luck.
This is for you.
So let's do this. Woo!
Most recently, my name is Freddie Semhauser. I'm going to be your host today. Welcome to Team Phenomenal Hope's 2020 Tour of Phenomenal Hope Championship Live.
All right, everybody. So with that, thank you again. It was just super great today. This totally motivates me, and I hope that you all have a great rest of your week. Heartfelt thank you to Cindy and Dr. Ryan for taking the time to share your thoughts today. You are the heroes of Carl Hicks today. So thank you very much. And if we didn't get to any questions, we'll try and reach out via email. You all have a wonderful day.
Bye-bye.
Bye, everybody.
Thank you.